We worked quite hard over the last 5 years to improve the quality of the policy documentation that the Labor Party had to offer to its membership and to the public. We've been through quite a rigorous process over the last 12 months to rewrite that platform. The whole of the Labor Party's platform has been completely rewritten, and that has just been endorsed at the end of last month at our state conference. It's a document which we feel proud of, that sets out Labor values, Labor beliefs, our achievements, and some strategic priorities to leading into what will be the next Labor government, hopefully early next year. I just wanted to mention a couple of those strategic priorities to you, and they're in areas that Phil's mentioned. One of the worst hit areas of our health system in Queensland has been in the areas of public health, chronic disease prevention and health promotion. This is where a lot of the jobs which Lawrence Springborg calls bureaucrats who work in head office or in a district were the easy ones to sack because they weren't in hospitals. So a lot of that work, which was about avoiding hospital admissions, about preventing chronic diseases like diabetes, like asthma, a lot of those jobs, those whole functions are just gone. They did this at a time in which federal Labor was expanding these types of services with a lot more national funding, with a number of national agencies to push it forward with a system of national health reform. Now, with an Abbott government, all of those reforms, 7 years worth of national health reform, have just been swept away. The National Preventative Health Agency is gone. Health Workforce Australia, gone. A whole range of agencies about improving the efficiency of our hospitals and the performance of our health system, the relationship between hospitals and primary health care with our GPs, a lot of those functions just won't be there anymore. So the LNP in Queensland thought that they could get away with reducing their footprint in the health system by outsourcing these things not just to the private sector, but also to the Commonwealth Government. Well, the Commonwealth Government is just shrinking away from these responsibilities as well. We have a very good health system in Australia, the design of it. It's a mixed system, a mix of public and private financing of our health system and of service delivery, a mix of private service delivery and public service delivery. That balance is being fundamentally altered by the LNP at a state level and at a national level. It is a drift towards an Americanisation of a market-driven health system where it's your ability to pay rather than your health need which drives the design of health services. And that's something which, across the whole of the academic world of experts in health systems and health policy, has united what is usually a herd of cats to actually say, look, this is wrong. A GP tax is a stupid policy. It's not just unfair to people who are poor and sick, it's actually economically a poorly designed policy. It means it will cost us much, much more in hospital presentations, emergency department presentations down the track. So we need to be fighting, and we are, to prevent these types of foolish policies being introduced.